We're going to get going. Good afternoon, everybody. Thank you all for joining us today for our virtual event. I am Andrew I. Cohen, and I am director of the Jean Beer Blumenfeld Center for Ethics at Georgia State University, and I also teach in the philosophy department at Georgia State. The center is delighted to bring to our community today's event, Healthcare and the 2020 Elections. This is the second of our 5-part fall series on the ethics of the 2020 elections. In each installment, we bring together noted speakers to campus virtually, and as today, we include experts and scholars from our community. Our events will foster constructive dialogue and reflection about how ethics impacts the choices we make as citizens and as human beings. This series looks especially at how ethics matters for our ballot choices and for shaping election policy. We are especially eager to reflect on how ethics of elections matters for historically marginalized communities. There are further details about this series available from our website, ethics.gsu.edu. This series is made possible with the generous support of our co-sponsors, Georgia Humanities, and the GSU Center for Human Rights and Democracy. We also thank our campus partners in making this event possible, the Panthers Vote Coalition, the Office of Civic Engagement, the Center for Studies on Africa and its Diaspora, the Department of Philosophy, the Center for Law, Health, and Society, and the GSU program in Philosophy, Politics, and Economics. The Center for Law, Health, and Society also announces that today's event can provide 1.5 optional CLE credits for attorneys. Interested persons should be sure to register also at the CLE link at law.gsu.edu/marketplace. Healthcare has become one of the biggest sectors of the American economy. As many of us know, though, per capita healthcare expenditures in the United States are among the highest in the world, yet leading indicators of health show the United States lagging behind many other wealthy countries. Among the most alarming factors is access to healthcare services among historically marginalized communities is routinely substandard. The United States is distinctive and unusual in other ways. It features third-party payment for medical services. This traces efforts by employers who circumvented wage and price controls that the Roosevelt administration had enacted during World War II. So they offered medical benefits that allowed them to attract and retain talented workers when they were legally forbidden to offer them a raise. But now, this is the system we've inherited. The costs of medical services are mostly invisible to many of us. Combined with other features of our regulatory landscape, we have a costly system that leaves many people by the sidelines. Social scientists routinely document these stunning disparities of indicators of health among communities who often live right next to each other. Now, to be sure, healthcare is not just a doctor and being able to afford medicine and surgeries, though it certainly includes those. It also includes dental care, which many people simply cannot afford, but access to which tracks so much else about overall health and success. Today's panel discusses such themes in healthcare, but with a particular eye on the ethics of election choices and election policy. Healthcare has become increasingly politicized. Government's involvement grows with Medicare and Medicaid, but access is still, at best, uneven. And this has crucial implications for our understandings of political legitimacy. Healthcare disparities, they matter by impacting opportunities to participate politically. Today, we bring together a distinguished panel of scholars to discuss the significance of healthcare access and the election. Joining us is Professor Yolonda Wilson, who teaches philosophy at Howard University. Following Dr. Wilson will be Professor Seema Mohapatra, who teaches in the law school at Indiana University. Following will be Professor Ruqaiijah Yearby, who teaches law at the St. Louis University School of Law. And commenting on today's presentations will be Georgia State University's own Dr. Rodney Lin, who is Interim Dean of the GSU School of Public Health. You can read about each of our panelists further in the brochure for today's event, which you can find at ethics.gsu.edu or on our Twitter feed at JBB Ethics Center. The format will be as follows. Each panelist will offer approximately 8 to 10 minutes of remarks, and then there will be a conversation among the panelists, and we will draw on questions by the attendees. Please submit your question in the chat in the Q&A on WebEx, or you can post your questions to the Twitter feed for the Jean Beer Blumenfeld Center for Ethics, which you can find at JBB Ethics Center. We're going to begin with Dr. Yolonda Wilson, who is Associate Professor of Philosophy at Howard University. Her research interests include bioethics, feminist philosophy, and social and political philosophy. Dr. Wilson has published in numerous scholarly outlets. You can read more about her at yolondawilson.com and on the brochure on our event website, ethics.gsu.edu. Let me plug an upcoming event. Dr. Wilson will deliver a research presentation to the philosophy department this Friday at 2 p.m. The talk will be titled Empathy and Structural Injustice in the Assessment of Patient Noncompliance. The event is free and open to the public. Please check ethics.gsu.edu for further details. Today, Dr. Wilson speaks to us about healthcare, elections, and access. Dr. Wilson.
Hi, good afternoon. Thank you so much, Andrew, for the introduction and for organizing and for the invitation, and also Donna Hardaway. I want to make sure that I give you a shout out and a hearty thank you for organizing and bringing us all together today. So I just want to start. I think I just want to start and give a bit of an overview, because I know that we're going to dig into some things, and I know that my co-panelists are going to speak a lot about kind of structural injustice and structural inequality, and of course these things are going to come out more in conversation. But where I want to start, and some of it is, by virtue of the fact that we are at Georgia State University, and I must say that I'm really excited to be here because I am a Georgian. I don't live in Georgia now, but all sides of my family have very, very deep roots in Georgia, as far back as anyone knows, and so I'm particularly happy to be here, but I'm also particularly interested in what happens in Georgia. So I want to start my remarks by taking us back to 2018, to Georgia's gubernatorial election. And this election, I discovered as I was kind of looking for some details, was so contentious that it now has its own Wikipedia page. So you can go to Wikipedia and look up the 2018 Georgia gubernatorial election, and it has its own Wikipedia. So just a little fun fact. But I'm sure much of the audience is in Georgia or is familiar with Georgia, but just to kind of recap, we know that Stacey Abrams was a state legislator running against Brian Kemp, who at the time was Secretary of State. And one notable feature of Abrams' campaign is that she expressed a commitment to rural health care. Now, of course, we don't know how deep that commitment would have remained had she become governor, and she's not governor now, so we can't assess that. But I found that a really interesting commitment, given some of the realities of what it means to be in rural spaces. And I don't by any means mean to suggest that the South is synonymous with being rural or that Georgia is synonymous with being rural, but I think sometimes in conversations about elections or the electorate, the notion of who is rural gets lost in what I would maybe uncharitably call certain forms of lazy journalism, where kind of perceptions of rural is just is not mediated by kind of realities of race and class and disability. So that Abrams made this commitment, again, was a notable feature for me in the campaign. And again, the narrative of who is rural intersects all sorts of identities and how we encounter structural injustice, so race, disability, class, and now increasingly in the South, immigration. And so I think that these are going to be important to think about as we're going into the 2020 election. Now, what was striking about that campaign, and I think one of the reasons why it has its own Wikipedia page now, is the kind of brazenness of the sitting Secretary of State also being the person who was one of the candidates in the election. So the person who had call over kind of how the election was going to go, or certainly had a hand. And I am not, let me be very careful, I am not accusing Brian Kemp of anything. I will say, he could have been, deeply and wonderfully impartial in how he conducted the election. But one thing that I think is important is that it just looked funny. At the absolute minimum, it looks funny for the person who's running the election to also be a candidate. And by funny, I mean disheartening. So what do I mean by this? And what does this have to do with 2020? Well, I think that Georgia, in an interesting way, became a harbinger for what 2020 could look like and what could happen in 2020. So among the issues that were really significant in Georgia's gubernatorial election, and here I'm not thinking about candidate platforms as much as this kind of overarching attitudes and ideas that were kind of floating around in the election discussion, but a preoccupation with voter fraud, for example, that wasn't quite supported by evidence. The idea of shutting down polling places so that people would have to travel further or wait in longer lines, and issues with actual physical access to some of the buildings. So those who had disabilities may have had difficulty actually voting. What I find interesting here is a kind of parallel to how healthcare looks in 2020, right? Particularly in rural spaces. Even urban spaces have similar issues, but I think it looks different. So the idea of having to travel 20 and 30 miles for healthcare, you don't see that as often in rural spaces. You don't see that as often in urban spaces. You'll see that more in rural spaces. But the idea in urban spaces of just not having access, or what access looks like, or not being taken seriously when one shows up. So we have this kind of parallel of not having access to voting by virtue of literally having to travel far or go through all sorts of hoops in order to make that happen. And then you have kind of similar parallels happening with healthcare, as Professor Cohen indicated in some of his opening remarks. And I also want to kind of point out, as we're coming up on 2020, the state of Mississippi is actually engaging in really making some really interesting moves. So their Secretary of State, Watson, is essentially in a fight now about how voting is going to happen in the midst of a global pandemic. And Watson is arguing that those who are at higher risk for serious illness or death as a result, if they were to contract COVID, engaging in an activity like standing in line to vote, should not be allowed to vote by mail. And again, here we hear this kind of preoccupation with voter fraud and voting by mail resurfacing in Mississippi in 2020, as we saw it in Georgia in 2018. Now, I don't mean to suggest that Georgia was the first place to have this preoccupation with voter fraud. We've been seeing this for the past decade and a half or so, really kind of reaching fever pitch. But it's very interesting that the state of Mississippi is taking this position in 2020 now, during a global pandemic, when many other places are trying to think about how to accommodate COVID risk. And we know that Mississippi is one of the states in the union that has, where its residents have very poor health status and poor health outcomes and disproportionate numbers of certain kinds of pre-existing conditions. So again, here we see literally in Mississippi a parallel between election policy and practice and healthcare as intersecting. Another area I want to think about for a bit as we're thinking through, COVID and the election is, who constitutes essential workers? And I know that some of my colleagues are going to delve into this a little bit more in their own remarks. And so I won't spend a ton of time just setting the stage, but I think that becomes an important site of conversations about the election itself and conversations about COVID. I mean, we've seen this in conversations about COVID, right? Who counts as essential? What kinds of protections are they going to be allowed or entitled to? Or do people even care about essential workers, right? Do we care about essential workers as human beings, or is the concern for so-called essential workers just insofar as they can engage in labor that makes life more comfortable for some of us? And just as kind of an interesting note, or something that I've been thinking about a lot since summer, is how campuses become a microcosm of this kind of attitude too. So, we've seen several campuses have a kind of grand opening, grand closing within a week or two. And, they'll put out these grand announcements. We've had to send students home because we care about our students. And meanwhile, custodians and cafeteria workers are still kind of there and not able to advocate for themselves. But also, very importantly, the language of students, right? We sent the students home is really interesting against the backdrop where places like the SEC conference, the ACC conference, are still having football. And so football players are still on campus, right? Students who play football are still on campus, all while the university is saying we care for our students. And I think we're seeing similar kinds of linguistic moves in discussions of COVID, in discussions of what the election cycle is going to look like, who needs to be protected, whose health and whose interests matter more, not just in conversation around election, but literally physically how people are going to get to the polls, or whether there's going to be a push to force certain people to the polls, or whether we're going to accommodate. And again, that plays into race, class, healthcare, disability, right? All of these things become connected. And I think I'll just stop right here. I know that more will come out in conversation, but I don't want to go over the 10 minutes. And so I'll let my colleagues kind of pick up from here. So thank you again. Looking forward to our conversation.
Thank you very much for your remarks, Dr. Wilson. Next up is Seema Mohapatra, who is Associate Professor of Law and Dean's Fellow at Indiana University's Robert H. McKinney School of Law. Professor Mohapatra has research interests in how the law engages biotechnology, public health, reproductive justice, and health equity. Professor Mohapatra has been widely published on such themes and has recently been a frequent commentator on health justice during the pandemic. You can read more about Professor Mohapatra's work on the brochure on our event website at ethics.gsu.edu or at Twitter at JBB Ethics Center. Professor Mohapatra's remarks are titled Structural Racism and Healthcare, How Elections Can Help. Professor.
Thanks so much for having me here today to talk about the structural racism in healthcare and how the elections may help. Much of what I will discuss today is based on joint work that Professor Ruqaiijah, Yearby, and I have written and published, and we'll have links to that at the end of her presentation. I'm going to try to, all right, I'm not going to worry about the slides. I'm going to speak for about 8 to 10 minutes today, and which my students will tell you is pretty much usually just my introduction. So let me just kind of tell you what I'm planning on discussing. I want to focus on the COVID-19 pandemic, which is demonstrating starkly how structural discrimination plays out in our healthcare system. And then I want to spend a couple of minutes discussing how the elections may impact healthcare access and public health infrastructure. And when we started this project back in March, the race issues in this pandemic were not as well known as they are now. But as you likely know, and the viewers likely know, the way that communities are impacted or affected by this pandemic, from being exposed to being tested, to being treated, to being stigmatized, this is all affected by the race and ethnicity. And there's so many examples of how race plays out in this pandemic. Hospitalization rates for COVID-19 are highest for American Indian, Alaskan Native, Black populations, Latino populations. And I'm going to talk a little bit today about why that is. And the last several months, we're seeing that even with limited data, we have African American populations, Native American populations, and Latino population bearing the brunt of the pandemic. And we're seeing this countrywide. There was a Washington Post a study that showed that in majority Black counties, their infection rates were 3 times higher than in majority white counties. And then there was a CDC analysis of 1,500 hospitalizations in 14 states, and they found that Black individuals made up 33% of the hospitalizations, even though they made up only 18% of the population in the area studied. And when you look at this data more granularly, it becomes even more stark. In Chicago, for example, African Americans account for 29% of the population, but have suffered 70% of COVID-19 related deaths in those whose ethnicity is known. And similarly, Native Americans are being hard hit by this pandemic. In New Mexico, for example, Native Americans make up 11% of the population, but account for nearly 37% of COVID-19 infections and 26% of the deaths. So racial and ethnic minorities are being disproportionately affected with COVID-19, not due to any biological differences between races, which don't exist, but rather as a result of social factors, primarily historical and current practices of discrimination. And so by structural discrimination or structural racism, which is in the title of this presentation and a lot of the papers that we're working on, what we mean is the ways that laws and policies are used to limit equal access to resources such as safe housing, such as quality health care, such as high-wage jobs. And prior to the pandemic, racial and ethnic minorities, especially women of color, disproportionately suffered from poor health outcomes due to structural discrimination. And as a result of these inequities, they're more susceptible now to contracting and dying from COVID-19 infection compared to white population. So if we're serious about addressing the problems arising from this pandemic, lawmakers, first of all, we have to vote, and I'm going to talk about that, but lawmakers must act to break down the root causes of structural discrimination, including housing, healthcare, and employment, to protect Black and Brown people from harm and provide much needed support. Now, structural discrimination in housing results in racial minorities more often living in substandard housing. The CDC finds that racial minorities are much more likely to be living in multi-generational housing, which during COVID-19 makes it more difficult to socially distance from others. And just last week, the CDC issued a nationwide eviction moratorium showing an acknowledgement that housing conditions absolutely affect health and the spread of COVID-19 in particular. Now, there's very serious issues related to structural discrimination that limit access to quality health care for Native American, for Black and Latino populations at normal times, but now even more so during this pandemic. And so things to think about are the closure of many healthcare facilities in towns that are predominantly Black, lack of enough testing sites and hospitals for treatment for COVID-19 in areas that are easily accessible to Native American, Black, and Latino populations, and known biased practices in healthcare delivery that may add to some delaying seeking care. Also, structural discrimination prevents them from even accessing healthcare services. For example, undocumented immigrants in the United States, most of whom are racial and ethnic minorities, don't have access to purchase healthcare through exchanges in the Affordable Care Act. And due to punitive immigration policies, such as the public charge rule and increased ICE enforcement, they're less likely to seek care even when they exhibit symptoms of COVID-19. So such lack of access is directly responsible for poor health outcomes and spread of the disease. Also, African Americans.
Professor, sorry to interrupt. If you'd like, we can show your slides.
Sure. I'm now on already. I think I'm on slide 7. I only have one more slide, so you don't have to worry about it.
Okay. Well, if you want to share your screen, then we can enjoy your virtual background.
All right, sure. Sorry about that. Should
I? Interruption.
can you see me or not?
Yeah, we're looking at your first slide, and if you go up to the top and stop the sharing, then we can get a fuller view. Sorry for the interruption.
No, that's okay. Hopefully that, oh no, that's leaving the event.
All right, we'll stick with what you got, and then we'll unshare later. Please go on.
All right. I did warn you, Andrew, that this is how it always is for me with technology. So I want to make sure that I have time to talk about that. African Americans have long been subject to bias and poor treatment by healthcare providers. And there are reports of many who, sought testing, being turned away because their symptoms were not being deemed serious enough. And when considering the fact that African Americans' health complaints are often dismissed and not believed, there's been many studies that showed that, there's reason to be concerned about African American access to COVID-19 treatment and testing, even if they are able to see a healthcare provider. And finally, explicit and implicit bias in the healthcare system is also compounded with the lack of Latino, Native American, and African American physicians that would be able to provide culturally sensitive care. And so the inequities that we're seeing in this pandemic are predictable. And we should have heeded the advice of healthcare researchers that have said forever that, in order to we need to address healthcare inequities because they are going to affect marginalized populations the worst, and that's what has happened. Now, this is where the election comes in, and we should proactively follow that same advice so that we're not in the same position. And so when we're deciding how the outcome of the election is going to matter, we need to look at who is prioritizing structural change. These policy decisions to ensure access to health care, increasing protections given by the Affordable Care Act to buy insurance, especially at a time that so many people are losing jobs. And in terms of, thinking about even a public option to buy insurance, who has that as a priority, and who has as a priority limiting or not enforcing the Affordable Care Act and the lack of support for enforcing the act. And so there's several priorities, and who we elect determines how the next few years and really generations are going to play out based on the access to healthcare services. And so structural discrimination in healthcare requires attention. Our public health infrastructure requires attention. The ACA, the Affordable Care Act, requires support and expansion. More people are losing insurance due to the employer-based system that Andrew referred to. It's vital that people think of healthcare when they cast their vote and think of who will support the policies that will help dismantle structural discrimination. Now I'm going to hand it over to Ruqaiijah, who's going to discuss this further, and she's going to focus on the plight of essential workers.
Thank you for that, Professor Mohapatra. So let's see if we can make Ruqaiijah the presenter on that. And let me give a brief introduction here. Next up is Ruqaiijah Yearby, who is professor at the School of Law and with the Center of Health Law Studies at the St. Louis University School of Law. Professor Yearby is also executive director and co-founder, Institute for Healing Justice and Equity. Professor Yearby's work focuses on racial disparities in healthcare, social justice, and healthcare distribution. You can read more about Professor Yearby on our brochure for today, which is available at ethics.gsu.edu or at Twitter at JBB Ethics Center. Professor Yearby is widely published in legal and medical ethics venues. Professor Yearby's remarks today are titled Structural Discrimination and Essential Workers.
Thank you for having me. I just want to check to see if you can actually see my slides.
I can see it.
Okay, so let's try to see if I can move them through. Did you see the change?
We did. Thank you. Go ahead.
Okay, great. So So as Professor Mohapatra mentioned, we have been working together to highlight the ways that structural discrimination have impacted access to healthcare, housing, and employment, which causes disparities in COVID-19 infections and death rates. And so I primarily focus on how employment has impacted those rates, particularly as a majority of essential workers are women and racial and ethnic minorities and the poor. Many current public health responses have issued stay-at-home orders and social distancing recommendations without actually taking into consideration the lived experiences of these workers who do not have paid sick leave and cannot stay at home. Why we highlight this is because these three main points, particularly around employment, were first highlighted in 2008 under a different administration. They were proven to be impactful for racial and ethnic disparities in the 2009 H1N1 infection. And under this administration, we have not made any structural changes to these issues. And so, as Professor Mohapatra highlighted, structural discrimination is about the way our systems are structured to advantage dominant groups and disadvantage minorities. And in particular, we noticed this in a model that we created that I think is quite relevant for today. And so when we think about sort of the root cause, the ways our systems are structured, but some of the tools that are used as the means to structure employment, housing, policing, public health systems is our laws. Furthermore, our political processes, the way we vote and who's actually in office enforcing and implementing these laws often leads to problems between federal and state, and between actually supporting and protecting essential workers versus simply focusing on money and the need to keep our economy open. And so I'm going to focus on employment and the ways that it's impacted essential workers in particular. So when we think about essential workers, a majority of the workers, as I mentioned, are women, people of color, poor people, and a majority are in healthcare, 30%, and 21% are food and agricultural workers. We see that they have been hard hit by infection, COVID-19 infections and deaths, particularly meat processing workers, healthcare workers, and now we're seeing a lot of focus on agricultural workers. Part of the problem with how these workers are being affected is, one, they don't have paid sick leave, they do not have health insurance coverage, they don't actually have access to treatment. And as we've seen, lots of healthcare professionals, government officials, instead of implementing policies to support these workers, are actually taking the time to blame them and to not enforce some of the health and safety laws that I have here. And so as we go to the polls, we need to think about who we're electing, who will uphold the laws, who ensure that they are covered not only by paid sick leave, hazard pay, but also to ensure that they do not contract COVID-19 at the workplace. OSHA has the power, along with states, to ensure that employees are provided with personal protection equipment. They also have the power to ensure that employers provide employees with a place of employment free of recognized hazards. Unfortunately, these measures still have gaps, which I will talk about a little later. Some of the gaps, however, in enforcement include the fact that OSHA and CDC have issued various guidelines on how to keep employees and employers safe and limit workplace exposure to COVID-19, but none of these guidelines are mandatory. Furthermore, they do not include discussions about mandating testing. They often use language blaming the workers and trying to educate them about the need to not carpool, particularly carpooling to places that are located in rural areas, which again goes against the lived experience. Many of the guidances were issued late. As we can see, for agricultural workers, it came in June, but by that time, numerous workers had been infected with COVID-19. Instead of addressing these gaps, particularly the gap by OSHA that said that not only were they not going to issue mandatory guidelines or guidelines to prevent the spread of airborne infectious disease, that they were going to let employers make a good faith effort to comply with these advisory worker health and safety guidelines. And in many cases, they haven't conducted in-person inspections. When they have, they've actually called the employer beforehand to let them know that they were coming. So all of these are gaps in protections in the laws, in the ways that we're supposed to be providing support and protection for health for essential workers. I want to now shift to the other ways that we have let down essential workers. And again, this is really tied to who is in office, who is working in these jobs that are supposed to be protecting these workers. We see many states, not the federal government, many states enacting state business liability laws. So instead of focusing on what are the ways that we can ensure the protection of essential workers who we say must continue to go to work, we're going to provide liability protection for their employers, even if we're not ensuring that they're providing support for these workers. So in Alabama, Iowa, Oklahoma, and what's interesting, particularly in Iowa, because it continues to be a hot spot for some of the COVID-19 infections, particularly in meat processing plants. In North Carolina, Utah, and Wyoming, we see the same passage of business liability laws. The difference here compared to the other states, however, is that they actually mention that nothing prevents people from seeking workers' compensation. And workers' compensation provides health insurance and payment for those who are harmed at work. Now, it's still questionable whether you can actually file a workers' compensation claim for being exposed to COVID-19 at work, but at least it's a step forward to balance the protections of the workers. So what are some of the solutions? We really need to think about putting people into office who will ensure that OSHA actually implements protections to protect these workers, and that's on the federal level and on the state level. We see OSHA and California passing laws to protect meat processing workers. We see in Michigan, actual governors, the governor enacting laws to protect farm workers, and also mandating testing for farm workers to be able to identify if people are infected with COVID-19 to ensure that that does not spread. Some other policy solutions include expanding workers' compensation to cover all essential workers and lowering the bar. It's often hard to prove that you have contracted some illness at work, but we see California, Michigan, and other states lowering the bar and making it a presumption if you get COVID-19 that you got it at your workplace, and so we are covering you. But again, these are decisions made by people in office, and so that's why it's so important that as you're going to the polls, that you pay attention to what the administration is actually doing. And with that, I'll just stop just highlighting some of the work that Professor Mohapatra and I have done on these issues and a report that I wrote about protecting workers that provide essential services in COVID-19. Thank you.
Thank you, Professor Yearby. Our next presenter is Dr. Rodney Lin. He will be commenting on today's presentations. Dr. Lin is the Interim Dean and Senior Associate Dean for Academic and Strategic Initiatives in the School of Public Health at Georgia State University. Dr. Lin is also an Associate Professor in the Department of Health Policy and Behavioral Sciences. Dr. Lin's research focuses on childhood obesity prevention, school and community health, and health disparities. You can read more about Dr. Lin's work on our brochure for today's event, available at ethics.gsu.edu and at Twitter at JBB Ethics Center. Dr. Lin. Dr. Lin, you may be muted. Excellent. Thank you.
Yes, so sorry. I just wanted to thank you, Dr. Cohen, for inviting me and for allowing me to join this esteemed panel. It's a real pleasure to be with you all today. What I've heard so far is a real emphasis on essential workers and COVID-19 and how it has illuminated structural discrimination and racism in healthcare and beyond. As we think about essential workers and this effort to tell people to work remotely, well, that doesn't really apply in many instances. We've said to people, stay at home when you're ill. That's hard to do if you don't have sick leave and your children depend on your hourly wage. If you live in a multi-generational household, how do you social distance if you have many people in your household? How do you stay at home if you're homeless? So these are real things that we often don't think about in our policy edicts and our decisions, and in many ways they are a reflection of our thinking and the lack of inclusiveness in that thinking. And our lack of acknowledgement of the root causes, as was mentioned earlier, of inequity, both in healthcare and beyond. I really thought that Dr. Yearby's comments just a moment ago about state business liability were, a real case in point and really demonstrative of some of the problems that we face as it relates to structural inequities and structural racism. The health inequity model that Drs. Yearby and Mohapatra presented that really highlighted tools, systems, and social factors, I think looked exceptional to me. I was really studying that, and I think it's really useful for us as we try to think about these issues. To sort of think about the broader issue that we're focused on here, ethics, the election, and our election policies, and how those really, with regard to communities of color and historically marginalized groups, elections matter. Local, state, national, they matter. Among other things, elections, the results really have the appearance of validating worldviews, ideologies, political philosophies, and we typically overread the meaning of election results. That's something that we do, and politicians do that more than anyone, but let's be clear that the results do matter. Without elections, if we think about the vision of civil rights leaders in the 1960s as an example, many of the things that they aspired for may not have been advanced through Lyndon B. Johnson's Great Society, policies and programs. So if we think about that, things that might not be law today without elections, the Civil Rights Act, the Voting Rights Act, Social Security Act, which included Medicaid, Medicare, another example. So really big fundamental pieces of society and things that are meant to really provide a social safety net and social supports. As we think about other policy that might not exist in the healthcare space. The Affordable Care Act is a great example. The Children's Health Insurance Program. One of the things I really want to emphasize today, and I understand the focus here is on healthcare, but I really want to make the point that health is much more than access to healthcare. If we look at health outcomes at a population level, only 20 to 30% of the health outcomes are accounted for by access to healthcare. So that means the vast majority of the determinants of health actually are outside of the healthcare space. And so if we think about policies in that regard, particularly as it relates to, with children and providing safe, nurturing, and health-promoting environments, vaccination is an example of, policy. We could say that's healthcare. Child safety seats, maybe not. WIC, SNAP, the Head Start program, even, having smoke-free environments. So there's so many things that are important for advancing public health beyond healthcare, but we recognize the fundamental importance of healthcare, I think in large part because of the inequity in access to it. So the goal here is policies that are providing a security, a social security, and a safety net, and ensuring that children and families can meet their basic needs. That children can establish and maintain healthy trajectories over time. So we've made some progress. I cited a lot of different policy that has been realized because of the ways that we have, as a nation, have voted over time. But there still remains massive inequities in access and outcomes. And COVID-19, as my co-presenters have noted, it just really has illuminated and laid bare those inequities. And so we really have to think about, from an election standpoint, what direction do we want to go as a nation? We can continue to look beyond healthcare in our policies and think about inequities in K-12 education, higher education, employment, access to capital to start businesses. And we've seen very recently, unfortunately, the inequitable norms and practices in policing and criminal justice. So there's much work that remains to be done. I think as we consider inequitable outcomes and our existing systems and structures, and we ask ourselves, well, what is the reality today, and why is it that African American, Latinx communities and other underserved communities continue to have less favorable outcomes on so many meaningful areas? You either have to believe that inherently these communities have lower potential and ability, or that the systems and structures are not serving them equitably. And I for one subscribe to the latter view. And so it really returns me to my first point that elections really matter. Nancy Cass, who's a public health ethicist, gives us a framework to guide our actions in terms of the work we do in public health programs and policies. And she asks us to consider, among other burdens, when we think about policy interventions, the risk to justice. And that is, if we propose public health interventions or policies that only target certain groups, then there's a real risk to justice there. Laws and policies that can impose by design or inadvertently threats to justice, they impose threats to justice if those regulations impose undue burdens on particular segments of society. So, what I would argue is that when regulations and policies widen inequities and or leave certain segments of the society underserved, that is a serious threat to justice. And from a public health and social justice perspective, it really fails in ethical analysis, and it really demands action. So in many ways, elections, I would argue, reflect our values and convictions, our view of the world, and really we have to be clear that there are risks to justice with the ways that we approach our politics and our elections. I guess I would end with a couple things just by saying that I think elections really invite us to discuss and debate our values and principles. They invite us to persuade others to see the world the way that we do, to join together with us to create a more fair, just, and equitable society. In the end, these elections matter greatly for shaping the trajectory of our society and for determining whether equity and justice will be a central, player in our policy. The very last point I'll make, and it's really me checking myself in some ways, is because I was thinking about my comments and really realizing that in some ways I was, setting up a situation where, we need to realize that elections are not a panacea. Whether Democrat or Republican, neither party has done enough to advance justice and equity. And we as citizens have agency, and we have to do what we've done and what we're doing now, and that is organize and demand change. So elections matter greatly, and this election is going to be very important, but we also need to be clear there's a need for accountability, and there's a need for us not to, if the election goes the way we, hope one way or another, that all of a sudden that means that equity and justice are going to be central in the policies that we see. Neither party has done enough. And so I think we just need to remember that. So I'll turn it back to you, Dr. Cohen.
Thank you for those remarks, Dr. Lin. Before we start gathering up some questions from people who are tuning in, and y'all should please feel free to submit your questions in the Q&A slot on WebEx, or you can get on to Twitter and post them there to the Ethics Center website, Twitter feed, that is, at JBB Ethics Center. So before we do that, I wanted to open it up to the panelists to have a brief conversation about each other's remarks, and then we'll start considering some of the questions that I see popping up. Professor Mohapatra.
Yeah, I really appreciated all the co-panelists' comments. And when Dr. Lin was talking, I know my camera wasn't on, but I was like, yes, exactly. I mean, a lot of these issues go so far beyond, first of all, healthcare. When we were talking about healthcare, people want to focus on insurance, but so many things affect public health. And both Professor Yearby and I have public health degrees. I'm an epidemiologist before I went to law school, so I really appreciated those comments. But I also appreciated the acknowledgement that no matter what happens in the elections, we really, there's the support, the financial support and the commitment that's needed for these public health interventions. I don't know if we have it for either party, and that's a reality that we have to face and advocate for. So I think that's a really important statement. And the focus on essential workers is the first presenter, and the presenter after me, that was great. So I learned a lot. So thank you so much.
I just wanted to jump in and say I always appreciate Professor Wilson's comments about focusing on rural areas because we don't do enough of that, particularly in COVID-19 and the closures of hospitals and just the lack of support that we've given those communities. And so going back to Professor Lin's comments about not necessarily hearing that much about that from either party, and really ensure that we focus on that.
Thank you, Professor Yearby. Some questions are filtering in, but I was curious about, I noticed a theme among many of the panelists worrying about government failure, and importantly, a sort of regulatory failure on the part of public authorities. And I'm wondering what y'all might say to a potential challenge that some people might raise to that, where they might say that there are many local and state administrations that at least pay lip service to the healthcare inequities that many of our panelists were talking about today and seem to be enacting certain public policies to target that. And according to some of these critics that I've heard and read, they say often these jurisdictions often are the ones that are on fiscally especially shaky footings, and often the public health indicators of the populations in those jurisdictions seem to be the poorest. So I'm wondering how you all might think we might reply to a concern such as that.
I could answer it, but I know Professor Wilson was about to say something before you posed your comment. Go ahead. Okay. So just quickly, I would say, but that's part of the issue, right? That's the whole point of structural discrimination and structural racism, is that we're structuring systems in a way that those who need the most get the least. And so you can look at it from a federal standpoint, the fact that CDC stepped in finally to issue a nationwide eviction moratorium. There's federal power. There's federal power in terms of money. And so the fact that we are not giving money, I think Professor Wilson mentioned to Mississippi, Arkansas, Alabama, to those places where people have poor health and those states have less money, really says something about the value we have of those particular populations. So no, I don't just think it's the state's responsibility, but I also think that then when they get the money, they need to take the lead in actually doing what's best for their citizens.
Thank you. And Dr. Wilson, I think you wanted to jump on.
Yeah. So, Dr. Yearby always gives me so much to kind of think about in my own head when I'm thinking through these questions. One thing I was going to say to you, Professor Cohen, was that, we talk about failings and inadequacies as though these are just kind of oopsies. And, one aspect of structural discrimination, yes, so structural discrimination doesn't require malintent, but I think we would be dishonest if we're suggesting that there isn't any malintent ever. And I think that also holds for so-called liberals or progressives. So when we think about states like Alabama, Mississippi, Georgia, my beloved Georgia, and Arkansas, I often hear so-called liberals and progressives kind of just saying, well, just let those places go to hell. Well, the rest of us will be over here caring for ourselves or one another, but who cares what happens to Florida? And you see the meme regularly on social media with, I think it's Bugs Bunny just sawing Florida off. Or seeing negative health outcomes or natural disasters or other tragic things happening, particularly in the South, with some sort of just desserts. And, I have to have these conversations with people all the time as someone who very clearly identifies as a Southerner. And I'm like, you're talking about my folks, right? I mean, and I don't mean that we should only care when there's self-interest, but I think that there's a kind of smugness that some liberals and progressives hold. And so when we think about structural injustice, structural discrimination, I think that Professor Lynn's remarks that neither party has done enough, I would even push that further, right? That in some ways, some of the neglect is not just benign, right? That some of the neglect is intentional, right? The roots of the neglect may be different. So Mississippians have a complicated racial history, as lots of places have complicated racial histories. Even something like Social Security, for example, we know that explicitly farm workers and domestic workers were excluded from participating in Social Security, right, as intentional moves to satisfy white Southerners. So, I'd just like for us to, and I think all of us have said in different ways that the picture is just a really complicated picture. And even in kind of giving a shout out to Stacey Abrams, I certainly didn't mean to create the, to imply that I think that Democrats are just so great, because I think that they have lots of shortcomings, and certainly their racial politics are among those shortcomings.
Thank you, Dr. Wilson. Looking at some of the questions that are coming in, please keep them coming. One is the following, asking the panelists about waving a magic wand. So if we could wave a magic wand, what is the one policy that you would pass to advance health justice? And the questioner suggests Medicare expansion, single payer, universal basic income, tax reform, restoring the Voting Rights Act, reverse Citizens United. What would you all suggest? So there's a pretty open-ended one for you. What would you suggest?
I just think it's a false choice. I mean, it's a fun question. I recognize that, but we didn't get here because of one or two policies. I mean, the structures that have been established over, hundreds of years, there's no one policy, one, waving of a wand that's going to undo that. It just is going to take sustained effort and focus and the expertise of, the folks on this, panel participating, those of us that care about these issues. And I think one of the challenges to even get to the question before is that, I say it's a challenge. It's a good thing that we live in a democracy, but it means that everyone gets a vote. And if the majority doesn't see things the way you see it, and sometimes even the majority does, the Electoral College has a way of, injecting its influence on outcomes. But the reality is that we have work to do in convincing the majority of our vision around equity and justice. And, I think in some ways ethics is we're balancing burdens and benefits in many ways. And we have work to do in convincing people that the burdens that we are proposing are worth the benefits. And, all of us believe that, but I just think that we've got to focus on that reality that it's not this small group. I mean, it's not, just people on the left. It's got to be a larger group that's making a commitment to this. So we've got work to do, I think.
Yeah, I'll just pipe in that I think that this is a question that I get often, like if I'm doing interviews with journalists, like, well, what's the one thing? And I think it's super difficult to say that. It's more of an and more of focusing on both long-term and short-term solutions. I do think that COVID-19 has, at least in public consciousness, at the same time that we have these kind of movement for racial justice and policing, there is at least it seems to be a national moment where there might be solidarity for some of these bigger changes that there hasn't been political will for. That's what I'm hopeful for, so that we can have the and part of the problems in public health is that they are not necessarily these sexy solutions. It would be great to have universal basic income. It would be great to have universal access to health insurance. It would be great to make sure that people have housing. We need to have an and kind of approach to it, but I think COVID-19 has shown us how interconnected we are, but because we have disproportionate impacts for these populations of color, for Black and Brown people, there are unfortunately still people that think, well, this doesn't affect us. And, kind of looking at through a solidarity viewpoint, I think is important to get us to a better place than we are now.
Thank you, Professor. One of the attendees raises a question pointing to the discussion about rural communities. And the questioner points to how these rural communities where we see these healthcare disparities tend to be strongholds for the incumbent president. And the questioner is wondering, are these rural communities voting against their own interests in terms of medical equity? And if that seems to be happening, how might people reach out to them in a productive way?
So let me just the mythology, and I think this is what I alluded to in my initial comments, and somehow I figured that we end up circling back to this. So there are more folks in rural communities who hold a particular viewpoint just because of the demographics of the nation. However, I think it would be a mistake to conflate rural with a particular demographic. And I think the reality is that a lot of folks who live in rural areas, and I'm from a rural area, right? A lot of folks who live in rural areas do not necessarily support the current administration, and there are lots of reasons, including the kind of structural issues around voting that I alluded to in my earlier comments. So that's one part of the issue, and we know that voter suppression is real and it's significant, and I think that it becomes even more pronounced in rural spaces where there are fewer places to vote in the first place, right? So that's one. But the second thing I would say, the New York Times, for the first couple of years of this current administration, and I've talked about this a few times in a few different places, spent a lot of energy and a lot of ink going to certain rural parts of the country and finding these kind of white people who were staring forlornly out the window and looking all sad and disappointed about kind of proposed changes to things like healthcare and Medicaid access and Meals on Wheels and such. And almost to a person, what these people would say when you'd interview them is essentially something like, I voted for Donald Trump, but I thought he would just stop giving free stuff to Black people, right? I didn't realize that my diabetes medicine could get cut too, or that my, access to food that happens through some of these social service programs could get cut too. But they never quite went far enough to say, and I regret my decision and therefore might need to make some different choices. And I think that what that points to, I think that the discussion about who's voting against their interest minimizes or fails to understand what people's interests actually are. And I think that if we're serious about racial justice, we have to understand that whiteness in itself is an interest, particularly for certain segments of the population. That, that people are willing to, that whiteness is a hill that some people are willing to die on. And so if it means that, I get at least the hypothetical possibility of accessing the kind of full range of benefits, then I might be willing to sacrifice or forego something like health or guaranteed employment. I mean, and we see certainly in Black communities that is not a new concept or a new idea. I mean, my mother talks about that all the time when she says, I'll just leave it at that. I'll point instead to a Chris Rock bit where he says something like, there's a broke one-legged white bus boy right now who wouldn't trade places with me and I'm rich, right? I mean, so just kind of alluding to the fact that whiteness in itself has value. And I think that if we're going to take seriously what people's interests are or who's voting against whose interests, we have to understand what people's interests are.
Thank you, Dr. Wilson. Before I grab other questions from the Q&A, I wanted to check if the other panelists wanted to jump in on this. Okay. Looking over to the Q&A, and keep those questions coming, everybody. Thank you for those. One attendee is wondering about more free market-oriented solutions and wonders about how free market persons, free market advocates might acknowledge that there are important needs for structural changes, but this attendee says, what would we say about such persons who would be concerned that some of the policy proposals that the panelists are suggesting may exacerbate the disparities that worry us?
So I can jump in. I was trying to actually type in an answer, but it has a limit, so I'm glad you raised it. First of all, from my work, I often question this idea that there is a free market, right? That the market system includes our biases, and it doesn't allow everybody to equally participate, right? It's sort of this presumption that free market is all about equality when not everybody has market power, has money, has the ability to actually participate. So I just like to state there that when we talk about sort of this free market, that is an illusion. I would say that some of the policies that we're going to sort of build on redistribution. But that's because they're short term, right? That we really need to think about changing the structure in a country where it's okay to have high levels of inequality. And that's because capitalism and a allegedly free market system, right? That, people get what they work hard for. And that has never been the case here or any other place. And so if we're really talking about disparities, yes, we have to get to a structural change, but that structural change cannot include the same sort of free market capitalistic system that we have. It really has to go into providing equal access and equity. And so I think, let me push us even further, that many people talk about equality as if just giving everybody the same thing is enough. And we have had historical injustices in this country, which show us that it actually needs to be equity, meaning that people who have gotten the least over generations need to get the most. So even though I definitely appreciate the question about will some of these policies result in more disparities, I would say they would do a better job than continuing down the path that we have been, which allows for the unequal distribution under the guise of free market, merit, and capitalism.
Thank you, Professor. Are there others who wish to contribute on that one?
What she said.
So while we're on this topic, we have time for one last question. One of the attendees is asking what y'all think, this is relatedly, about free healthcare and whether that would be a policy recommendation y'all would support and why.
I mean, I would just say that I'm not sure what free healthcare looks like. The system we have in this country is so fragmented with so many different stakeholders that, I'm not sure when people say free healthcare, what that really looks like. Even Medicare is not quote unquote free. So it's going to be paid for somehow. The question is, how do you finance the healthcare system in a manner that produces equitable access, equitable care in terms of quality, and then equitable outcomes to the extent that the healthcare system can contribute there. So it's really a question of financing structure, and there are a lot of proposals on the table. Ultimately, I think I hate to keep going back to mechanics of the political system, but the filibuster is a real thing, and unless there's going to be significant changes in who's controlling the executive and the Congress, the real large fundamental change that we're talking about, whether in healthcare or education or anything else, is going to be very difficult to achieve for that very reason. The ability of one party, the minority party, to stall this kind of equitable approach to healthcare policy. So I think there are a lot of proposals that would allow us to do far better than we're doing right now. But there's a long way to go on the political side. Elections matter ultimately.
And I'll just pipe in that we don't really have a healthcare system. We have more of a sick care system where people are, the way that we have payment structured in the health insurance industry is really based on, treatment for sickness, and we don't have the kind of preventative, deep preventative care that you would need to actually have a healthcare system. And so, I think there's so many structural issues with our system, and even when we're talking about the Affordable Care Act, most health policy and health law experts will say it was a very incremental change, but it actually did improve health, improved who was being insured, improved access. And so, even when we are talking about incremental change and you think about the fact that this administration has kind of worked for so long to try to repeal the Affordable Care Act. There's still a case in the Supreme Court that's going to be heard in October about this. And so, even with incremental change, so having a whole, whatever kind of overall of the healthcare system overhaul is, I think, a little bit unrealistic.
Well, thank you, Professor. Our time is drawing to a close, so I'd certainly like to thank the panelists, and let me make a couple of shameless plugs for other events that we have coming up. On Friday, this Friday, Dr. Wilson will be appearing in a research presentation to the philosophy department. You can read more about that at ethics.gsu.edu. On Thursday, October 8th at 2:15, there will be a panel discussion on the insignificance of voting, and we'll have some experts on that. And then later in the month, we're going to have another panel discussion that's talking about voting with your hands or voting with your feet. That's on Thursday, October 29th. Full details about the series is posted at ethics.gsu.edu. Very much like to thank all of our panelists for contributing to a very constructive discussion about this complex issue. It's very important as we're facing this election and as we're rethinking and reconsidering what health policy ought to be. Thank you all very much, and we wish you all the best. Take care. And this recording, by the way, will be available on the Ethics Center website in about a week or two. Be well all.